for total positive in the acute care setting at Hartford Hospital, at this time we have 35. And for PUIs, there's 270. And on the outpatient side, Behavioral Health Network continue to have 0 positives and no PUIs. And for the Community Health Network, there's 78 positive patients and 11 PUIs at this time. So Community Health Network with 78 positives and 11 PUIs. And overall total for the system is 113 positive, COVID positive patients, and 281 PUIs. And again, I'll remind you the high we've been for positive is 425 patients. So huge, that's huge. So next thing I want to discuss is our efforts with expanding testing and expanding our capability to test. And our mobile test sites, which we basically go in and organizing with community members and set up sites and get be more available to the community. And yesterday we were at Bloomfield at the First Cathedral Church. Very good collaboration with the church, the community members. The mayor was there and getting a number of people coming out to get tested. And there's a number of people with questions about the COVID-19 disease process and also about different infection prevention, infectious disease practices. And we're able to give answers on that. I had the opportunity to speak at that opening, and one of the things that I spoke about is the fact that we will put a significant amount of effort, we as in Hartford Healthcare, to ensure that we're expanding our capability and expanding our availability, which I think is so significantly important, especially to the communities around Connecticut. But the other piece of it is, the other piece that's significantly necessary to make this work is to ensure that as much effort that we're putting in, people are coming out to get tested. Testing is identified as one of the most important pieces in ensuring that we have the data, not just have the data to do the predictive modeling that was so critical for us to do the reopening that we are in right now, but also it's very critical from an infection prevention perspective because there's so many people that are asymptomatic with the disease process, and testing will allow you to know if you're positive and will allow you to quickly isolate yourself and protect your loved ones, isolate yourself and protect your community, and isolate yourself and in turn protect your household. So again, this is a plan and a commitment from Hartford Healthcare. We will be reaching out to a number of community areas, setting up mobile sites. And with that, we ask that people advertise that the availability of testing. It's a very easy process. No orders, there's no pre-order that's necessary. There's no need for you to get in contact with your PCP. All you need to do is to come down to the testing site and we get testing done for you. Very easy process. It's, as I said, a very collaborative partnership. I really want to genuinely thank the First Cathedral Church in Bloomfield for having us and helping us help the community. With the second phase of the reopening, there's a number of questions we've been getting as to, how do we think this is going to go, and how do we think this is going to impact the numbers. So if you look at the fact that we're opening and we're expanding the opportunity for people to meet each other, to be around each other, you would think that this in turn expands and increases the opportunity for people to be exposed. I say yes, it does. But if we do extend those practices that we've been doing very well over the last few months, I think we have a great opportunity to ensure that this increase in risk doesn't translate to an increase in cases. One of the interesting conversations that I've had with a few people across the country, with most surges that they're seeing in areas within healthcare or within areas of the healthcare system that are least exposed to COVID. And how that translates to is the areas that have more positive COVID patients are more aware and keep more vigilant on their PPE usage. They're more vigilant on their infection prevention practices and their universal mask strategies. So this is very important. We need to ensure that these processes and practices are in place and maintained in place in order for us to come out of this and keep enjoying the phase 2 reopening and any phases after. Another question that we've been getting is COVID-19 recovered patient, what to expect. So there's a few things that we're still not too sure about, and Dr. Henry will ask him to comment on as well, is we know COVID positive patient will have the antibody, or should have the positive antibody, and we aren't 100% certain yet if the antibody means immunity. So the sooner we get to that answer, the better it is to answer this specific question. But I will say, recovering from COVID, some people that are on the critical, well, we're on the critical side and is recovering, it takes a while for them to get back to 100%, and just keep that in mind. Keep communicating with your provider, get your regular checkups and all scheduled visits afterwards, and report in, and as I said, the healthcare system is a safe place to be now. So keep coming into your healthcare system and getting checked up, and we'll be able to help you through that process. In terms of numbers, and I think the magic question is always, what do you think is going to happen over the next few weeks? As we discussed before, a few things have changed. We've opened up and increased our opportunity to socialize, and hence possibly increase our risk as well. But should there be a natural increase in number based on that? I think simple math would say yes, absolutely. But we can change that process and change that by maintaining, again, social distancing, infection prevention practices such as hand hygiene, report symptoms as soon as possible, isolate yourself if necessary as soon as possible, use your healthcare system, it's a safe place to be now, get your regular checkups, so remove those comorbidities. So if you do get ill, then you're not falling into the critical high mortality phase of it, and definitely ensure that you're wearing your mask when necessary. So at this time, I wanted to introduce Dr. Henry, who is an infectious disease specialist, infectious disease physician at a hospital of Central Connecticut. Dr. Henry is an esteemed colleague of mine, and welcome, Dr. Henry.
Thank you, Kate.
So, Dr. Henry, in the question in regards to, as I said before, the antibodies and patients recovering from COVID, what are you seeing? What should be the expectation for these patients?
That's right. So it's a very interesting question, and the fact is we don't really know for sure if these antibodies are neutralizing antibodies. That means that we don't know if having those antibodies really mean immunity. If judging from SARS and MERS, we probably know that people will have some form of immunity for a while, and even as to how long the immunity will last after an infection is not known for sure.
Okay, good. And I know I spoke about the reopening, so phase 2 reopening, and I know I gave my part and what the expectation is, and practicing safe distancing as much as possible. Is there anything you'd like to add on that?
That's right. So what I would want to add is that I know a lot of us are very conflicted when it comes to reopening. We have conflicted emotions because on one hand, we want to see our businesses up and running. We want to enjoy some form of normalcy that we haven't had in a long time. But on the other hand, we are also concerned because of the possibility of another spike in cases. As you rightly said, yes, it is possible because we're giving people the opportunity to mingle with each other, to meet each other. So it's possible that we could see a spike in cases. But overall, what I keep saying is that we are better prepared now because at least we know how this virus is transmitted, and we know some of the techniques that we can use to interrupt the transmission of this virus. And above all, our healthcare facilities are very well equipped, and we have the capacity to take care of patients. So what I would say is that the virus hasn't gone away, and the tornado is still out there, and it hasn't gone away. So we shouldn't behave as though the virus is completely gone. We should open in a careful and rational fashion because the virus is still out there.
Okay, good.
We should. The only reason why we are even talking about reopening right now is because of our collective efforts at physical distancing, using enhanced hygiene techniques, and masking. So I think if this has helped us and saved us and brought us this far, then we should continue what we've done over the last 4 to 5 months and continue social distancing, or as I say, physical distancing, masking, and enhanced personal hygiene.
Good. Thank you so much. And one of the things that we've spoken about a few times on when we have the opportunity on this forum, the CDC, I know, released some data a few weeks ago regarding to, the use of the hospital system or healthcare system had reduced exponentially. The ED, I think, is like 45% decrease in use of the ED. Any comments on the safety? I know you're also seeing patients on the outpatients. Any comments on how are your patients responding to the reopening, and how safe do they feel?
So I think it's going very smoothly, and if there's any safe place out there, at least I would say that it's the hospitals, right? Because we are testing everyone who is coming, who is being admitted, right? So we have a sense of who has the disease and who doesn't have it. Going out there in the community, people that you're interacting with, you don't even know whether they are pre-symptomatic, whether they are asymptomatic, or whether they have the disease, right? But in the hospital, we are testing everyone who is admitted. In the outpatient setting, we have enough PPE. Our clinicians are wearing PPE appropriately, and patients who come in are also wearing masks. So it's a very safe place to come for care, and we shouldn't push away primary care and wait until later, because diseases don't wait for us. I think it's very safe to come for our clinic appointments, to go to the ER if need be.
Good. Thank you so much. All right. I have nothing, no further questions for you, Dr. Henry. Anyone on the phone, any questions? No? Tina, anything? No question? All right. All right, guys. Thank you so much. Have a good day.
All right. Thank you all.
All right, sir.